If you're currently suffering from a chronic illness, chronic pain, anxiety, insomnia, or autoimmune conditions, or any other chronic disorder, here is why prescriptions alone will almost never treat the root causes of what you are suffering. In this video, you will understand three things. First, why the health system is not suited for chronic illness. Second, why treating the root causes matters more than suppressing symptoms. And third, what you can do if standard medicine isn't helping your condition. I'm Dr. Jingduan Yang, a board-certified psychiatrist, integrative medicine physician, and a fifth generation of Chinese medicine practitioner. I have spent over 30 years treating thousands of patients with chronic illnesses after mainstream medicine had not worked for them. American healthcare spent over $4 trillion a year, yet US ranks outside the top 40 countries in the life expectancy. According to the CDC most recent national survey, 76% of American adults have at least one chronic condition, and more than half are managing two or more. Over the past 2 decades, rates of depression, anxiety, and addiction have kept rising. But the public trust in doctors and hospitals has dropped from 71% to 40% in just 4 years. These are not separate problems. They are symptoms of a system that was never designed to produce health. Modern medicine has accomplished extraordinary things, eliminating deadly infections, revolutionized surgery, and extending human lifespan. But modern medicine is constrained by the system it operates in. It is a system designed to manage acute crisis, not to produce sustainable health. It uses prescriptions to suppress symptoms rather than solve root causes. And it treats disease categories with standard protocols rather than treating the individual who carries them. That's why the same treatment can heal one patient, harm another, and completely fail a third. And if modern medicine has not worked for you, you're not imagining things, and you're not alone. When you have a chronic condition, most doctors will prescribe you medication. But these prescriptions are designed to suppress symptoms, not to resolve causes. If you have chronic pain, you are prescribed pain medications. It quiets the pain signals, but it does not solve why the tissue is inflamed, why the nerves are hypersensitive, and what is causing the pain. If you have anxiety, you're prescribed a SSRI or a benzodiazepine. I have written thousands of those prescriptions myself. The medication changes your neurotransmitter activity artificially and disruptively, but it doesn't address why your nerve system is dysregulated, what nutrients deficiency may be present, or what unresolved trauma may be maintaining it. Each of these medications can be helpful in the right context. The problem is what's not being addressed alongside the medication. If the underlying cause continues, the symptoms continue too, and you'll need the medication indefinitely. And over time, you'll need more medications to manage side effects and additional medication to manage new problems that develop from taking the first medication for years. This isn't treating the root cause. This is managing symptoms. There is fundamental difference here. To be clear, never stop or change a medication on your own. Talk to your prescriber. This video is about what needs to happen alongside your treatment, not to stop or replace your treatment. Here's something the current medical system rarely acknowledges. The human body operates as a single system. What you eat affects your brain. Your physical posture influences your hormones. Your emotional state affects your immunity. Modern medicine has substantial research supporting each of these connections. But the healthcare system has fragmented these connections into isolated specialties. Psychiatrists rarely test your nutritional status. A cardiologist doesn't evaluate your mental well-being. A gastroenterologist doesn't ask about your emotional life. Each specialist does an excellent job within their domain, but your chronic illness is caused by patterns that crosses domains, and not single specialists can see the whole picture. I have had patients come to me after seeing multiple specialists. Each one gave them a different diagnosis, a different prescription. None of them treated the person as a whole. This isn't the specialist's fault. It is the system structure. And it is a major reason that so many chronic illnesses never get resolved. Over 30 years of clinical practice, I developed a framework to address the whole person. I call it ACEs model. ACEs stands for anatomy, chemistry, energy, and soul or spirit. Anatomy is your body's physical structure: bones, muscles, fascia, organs, posture, and alignment. When injury or structural damage compromises your anatomy, everything downstream is affected. Structural problems can compress nerves and drive persistent pain patterns. Chronic muscle tension alone can keep going for years. Chemistry is a biochemical environment inside you, and hormones, nutrients, inflammatory markers, methylation, mitochondrial function, and detoxification. When your chemistry is out of balance, even a perfect structure cannot produce health. A patient with severe fatigue may not need a stimulant. They may need a thyroid support, anti-inflammatory nutrition, and the correction of nutrient deficiency. Energy is a flow of vital force through your body. Autonomic nervous system tone by electrical activity, cellular communication, breath pattern, and heart rate variability. Classical Chinese medicine calls the qi and the meridians. Disruption in this dimension show up as pain, anxiety, insomnia, chronic stress, and lack of vitality. The soul is your meaning, purpose, identity, and spiritual connection. This is the most overlooked dimension in modern medicine, and the one many medicine leaves out entirely. Let me tell you about one patient. A woman in her 50s came to me with years of insomnia, chest tightness, and anxiety. And she had seen a cardiologist, a gastroenterologist, and 2 psychiatrists. Her heart was fine. Her medical tests were normal. She was on 3 medications and still not sleeping. Anatomy and chemistry were only a part of the problems, not the whole problem. What surfaced was a loss she had never grieved. A parent who had died more than 20 years earlier, during a time when she had to keep going and could not stop. No medication could even reach that. When we addressed it with acupuncture, with the right nutritional support, with a neuroemotional technique, with the work of finally grieving, her sleep returned. And over the following month, 2 of 3 medications were gradually decreased by her prescriber. Some of my patients only began to recover from chronic illness after resolving decades-old grief. Others began to heal after rediscovering a sense of purpose. These 4 dimensions operate together. They cannot be separated. At the Yang Institute of Integrative Medicine, We practice the ACEs model as a complete clinical framework. I developed this approach over 3 decades, combining modern Western medicine, classical Chinese medicine, integrative medicine, functional medicine, and advanced nutritional therapy and psychiatric care into one coordinated evaluation. So when you come to us, you don't see one specialist and get referred elsewhere. You receive an evaluation across all 4 ACEs dimensions from a coordinated clinical team, led by physicians who understand how the dimensions connect. Seeing a chiropractor, a nutritionist, an acupuncturist, and a therapist separately gives you 4 opinions, not one coordinated picture. The real resolution requires physicians who work across all 4 dimensions and coordinate care. That is what Yang Institute provides. If you are suffering from a chronic illness that the standard approach hasn't resolved, and you want physicians who will treat you as a complete human being across all 4 dimensions, visit yanginstitute.com to learn more about the ACEs 4-dimensional approach and to book a consultation. Online consultations are also available in some states like New York, New Jersey, and Pennsylvania. See the website for details and tell me in the comments what chronic condition has mainstream medicine not been able to resolve for you. I read every comment. Thank you for watching. I will see you in the next video. Please subscribe, push the bell, and share with people who need it.